Okay, let's unpack this. That awful feeling, right? When your pet seems way too interested in something they absolutely shouldn't be.
Oh, yeah. A dropped pill, maybe.
Exactly.
Mhm.
Or you turn around and think, oh no, did they just eat that? Today, we're doing a deep dive into something potentially really serious for pets: accidentally eating our meds.
Hmm.
Specifically, we're looking at tricyclic antidepressants, TCAs. We want to sort of unravel what actually happens inside a dog or cat if they get into these.
Yeah, it's quite something because these medications, they're meant to help us, but they can cause a real chemical storm inside our pets.
The chemical storm. Okay.
Yeah, and we're using a medical reference on antidepressant toxicosis to really get into the effects, what signs you need to watch for,
Yeah.
basically how knowing this stuff can help you protect your animals.
Exactly. Look, the idea isn't to scare anyone, but just to equip you with, essential understanding. What are these TCAs? What kind of chain reaction do they set off? And what are the big red flags?
Right, so let's start at the beginning. What are TCAs? Well, the source material calls them a class of antidepressant meds.
Okay.
You might even recognize some names: amitriptyline, amoxapine, clomipramine, uh, disipramine, doxpin, imipramine. Also mapprotaline, though it's technically a bit different, it's often grouped here, nortriptyline, protriptyline, triipramine.
Wow, that's a lot.
And the source says many others, so it's a pretty big group. They all have a similar chemical setup, and crucially for us, a similar way they mess with the body's normal functions.
Okay, so these aren't some obscure drugs. They could easily be in someone's medicine cabinet. Now, for people, what's their main job?
Well, basically, they work by stopping certain chemicals, norepinephrine, dopamine, and serotonin, from being taken back up by the nerve cells.
Uh-huh.
Blocking that reuptake means more of those chemicals hang around in the brain for longer, and that's how they help with depression in humans.
Okay, makes sense for humans. But what happens when, a dog or cat suddenly gets a flood of this stuff? Their bodies aren't set up for it. Sounds like chaos.
Exactly. Chaos is a good word. And it's not just those neurotransmitters. TCAs also have this anticholinergic effect.
Mm.
They block another key chemical messenger called acetylcholine.
Okay.
Plus, they can mess with the heart muscle directly.
Yeah.
They interfere with these tiny gates, fast sodium channels in the ventricles, very important for a normal heartbeat.
Wow.
And on top of that, some alpha-adrenergic blocking, even mild antihistamine effects.
Yeah.
So yeah, think chemical storm hitting multiple vital systems all at once.
A chemical storm. I like that analogy. Let's break it down. How does this storm hit the nervous system first?
Well, as you'd expect, with all that extra dopamine, serotonin, and norepinephrine floating around in the central nervous system,
Yeah.
you start seeing neurological signs.
What
And these
is-
can show up in lots of different ways, which I'm sure we'll get into.
Okay. And then the cardiovascular system. You mentioned those gates in the heart muscle. Sounds like that's a major target.
Oh, absolutely. The heart effects are pretty complex. That anticholinergic bit and the norepinephrine reuptake blockage, that can speed the heart up tachycardia.
Fast heart rate.
Okay. But then you also get the alpha-adrenergic blocking,
Yeah.
that sodium channel interference, and the heart muscle just can't contract as strongly.
Oh, wow.
Put it all together. And you can get hypotension, low blood pressure, and really dangerous arrhythmias, irregular heartbeats. That direct hit on the heart's electrical system and its ability to pump, that's a huge concern. It just throws the whole thing off.
It's like the heart's getting conflicting signals and its basic rhythm is just gone haywire. What about other parts of the body, like the digestive system?
Yeah, the GI tract gets hit too, mostly from those anticholinergic effects again.
Right.
It can cause a Lewis. Basically, the intestines just slow down or stop moving properly, and it delays stomach emptying.
Okay.
And what's really tricky is that this slower movement
Mhm.
can actually affect how the drug itself gets absorbed. It might hang around longer, making the toxic effects last longer.
So the body's attempt to get rid of it is actually slowed down by the drug itself. That's nasty. The source mentioned eyes and the urinary system too.
Correct. Again, that anticholinergic activity is the player here. It can cause the pupils to dilate mydriasis.
Big pupils.
Yep. And in the urinary system, it can lead to urinary retention. Makes it hard for the pet to pee.
Okay, so this cascade just ripples through everything. How fast does this all kick off after a pet eats a TCA?
Generally, it's absorbed pretty fast from the gut. But like we just said, that delayed stomach emptying can sometimes slow things down a bit.
Right.
The source says signs of toxicosis can pop up quite quickly, maybe 30 to 60 minutes, but they can also be delayed for several hours.
Oh.
So even if your pet seems okay right away, you absolutely have to stay vigilant. It's unpredictable.
That variable timeline must be incredibly stressful for owners. So what are the actual signs people should be watching for? if they suspect their pet got into these meds?
Well, the first thing, and the source really stresses this under historical findings, is any clue about accidental ingestion.
Like an open bottle, missing pills.
Exactly. That history is vital. Then, the actual observable signs. There's the whole range affecting different systems.
Okay, break it down for us. What might you see in their behavior, and what about physical symptoms?
Neurologically, you might see CNS depression. So like really sleepy, lethargic, or maybe ataxia, kind of wobbly, uncoordinated.
Okay.
But weirdly, you might also see the opposite. Increased vocalizing, agitation, restlessness. Tremors are possible, and in bad cases, even seizures.
Seizures, wow.
Yeah. GI-wise, vomiting is common, and maybe excessive drooling, hypersalivation. Breathing-wise, you might notice excessive panting, fast breathing, that's tachypnea, or even difficulty breathing, which is dyspnea.
Those all sound pretty scary. What about things a vet might find during an exam? More physical stuff.
A vet might pick up on that CNS depression or stimulation too.
Yeah.
Cardiovascular-wise, they could detect tachycardia, that fast heart rate, maybe initially high blood pressure, hypertension, but that can then crash into hypotension, low blood pressure.
Right.
And of course, those dangerous arrhythmias we mentioned. They might see pale gums pallor or even a bluish tint, cyanosis, which means poor oxygen flow. Other things, mydriasis, those dilated pupils.
Oh.
Body temperature can go either way too low, hypothermia, or too high, hyperthermia. Urinary retention, constipation. Also possibilities.
A lot can go wrong.
And here's something important the source notes.
Yeah.
Signs can sometimes happen even at therapeutic doses in certain animals.
Really?
Yeah, every pet reacts differently. Smaller pets might get hit harder, obviously, and maybe very young or old animals could be more susceptible too.
So even a small amount isn't necessarily safe, depending on the pet. Are there things that make a pet more likely to have a bad reaction?
Yes. The source mentions a couple of key risk factors. Taking other antipsychotic meds at the same time. That could potentially amplify the TCA effects.
Okay, that makes sense.
And a big one is pre-existing heart disease. The extra stress from the TCA on an already weak heart, that's really dangerous.
Yeah, absolutely. So if a vet suspects TCA poisoning, how do they confirm it and rule out other things?
Yeah. Good question. The differential diagnosis is key. They have to consider other poisonings, right? Other antipsychotics, maybe stimulants like amphetamines or caffeine, other drugs that cause arrhythmias.
Lots of possibilities.
Definitely. And also non-poison things that look similar, like high potassium levels, heart problems like ischemia or cardiomyopathy, conduction issues. What's interesting is that standard blood tests like a CBC, chemistry panel, urinalysis, often come back normal in TCA toxicity.
Oh, really? So the basic tests might not show anything?
Right, which can make it trickier. But there are other tests. Blood gases might show metabolic acidosis and acid imbalance.
Okay.
There are over-the-counter urine drug screens that can pick up TCAs, confirming exposure. But, and this is important, they don't tell you how bad the poisoning is.
Just that it happened.
Exactly.
Yeah.
Same with measuring TCA levels in the blood confirms exposure, not severity. The source really points to ECGs, electrocardiograms, to watch the heart rhythm closely, and blood pressure monitoring as crucial diagnostic tools.
Right. So history, signs, and specific tests build the picture.
Yeah.
What about treatment then? What's the immediate plan?
Well, first off, the source is pretty clear. Don't try to manage this at home if the pet has symptoms or known heart issues or ate more than a therapeutic dose.
Hospitalization needed.
Generally, yes.
Yeah.
Needs close watching. Now, decontamination. If the pet is asymptomatic and it just happened, like maybe within 15 minutes, making them vomit might be an option.
Inducing emesis.
Right. For really big injections, maybe gastric lavage, washing out the stomach, but that's usually under anesthesia.
Okay.
After that, or if more time has passed, activated charcoal is really key. It helps bind up any drug left in the gut.
Like a sponge?
Kinda, yeah. Often given with a cathartic, something to speed things through, like sorbitol or sodium sulfate, with that first dose. Unless the pet already has diarrhea, then you'd be cautious.
Makes sense.
And they might repeat a half dose of charcoal a few hours later, especially if the pet's still showing signs. So priorities are decontaminate early if possible, then stabilize the heart and the nervous system.
So stopping more absorption is step one. What if symptoms are already there?
Then it shifts to stabilizing those systems, cardiovascular, central nervous system, and just supportive care.
Like what?
Things like IV fluids, very important for hydration and keeping blood pressure up if it's dropping, keeping their temperature stable because it can swing wildly.
Right, you said higher or low.
Exactly. Maybe an enema if they're not passing stool. And if they're vomiting, probably nothing by mouth. MBO for a bit.
Okay. Are there specific drugs used to counteract the TCAs themselves beyond just getting them out?
Yeah, several, depending on the symptoms. There's cyproheptadine, which can help with something called serotonin syndrome that can sometimes happen with TCA overdoses, especially if other serotonin-ficking drugs are involved.
Serotonin syndrome. Okay.
And interestingly, the source mentions intravenous lipid emulsion, IVL.
Lipids, like fats.
Exactly. It's a bit more specialized. You give this fat solution intravenously. The idea is that TCAs are lipophilic. They like fats. So they get drawn into this lipid solution in the bloodstream, kind of trapping them there so they can't reach the organs they're harming. The source gives specific dosing for that.
That's clever.
It can be, yeah.
Yeah.
Then sodium bicarbonate might be used if there's that metabolic acidosis for agitation or seizures, things like diazepam or maybe acipromazine, and phenobarbital for really stubborn seizures.
Sounds like a pretty intensive toolkit they need. Are there things they absolutely should not do? Treatments to avoid?
Definitely. Important contraindications. Atropine is a no-go. TCAs already have those anticholinergic effects, remember? Atropine would just make it worse.
Right.
Magnesium sulfate should be used as a cathartic, either risk of absorbing too much magnesium if the gut's not working right.
Okay.
Beta blockers, often used for fast heart rates, should be avoided here because they could make low blood pressure even worse.
Got it.
And like we said before, never try to make a pet vomit if they're already showing signs.
Yeah.
Too risky.
Crucial points. What about interactions if the pet's already on other meds?
Yes, interactions are a big deal. Combining TCAs with MAOIs, another type of antidepressant, massively increases the risk of hyperthermia, seizures, even death.
Wow, okay.
Also, using them with other drugs that are sympathomimetic or anticholinergic can really ramp up the risk of heart problems, like arrhythmias. And there's a specific note about increased arrhythmia risk if used with levothyroxine, that common thyroid medication.
So knowing everything a pet is taking is absolutely critical for the vet.
Oh, yeah.
Okay, what about recovery? What's the outlook usually?
Well, ongoing monitoring is essential. Watching acid-base status, blood pressure, ECG. Got to keep that up until the pet is totally symptom-free. And the source keeps coming back to prevention, obviously. Keep those meds locked away, safely out of reach. It's the best thing.
Always.
Prognosis-wise, mild to moderate cases, generally good with the right treatment. But the source does warn about pulmonary edema fluid in the lungs, sometimes happening if fluid therapy is really aggressive.
A possible complication.
Yeah. And how long symptoms last? It varies. Depends on the specific drug, how much was ingested. Could be up to 24 hours, maybe even longer. The outlook gets more guarded, less certain for pets with severe signs like seizures that won't stop, bad arrhythmias, or blood pressure that just won't come up despite treatment.
It's really sobering how a simple mistake can become so critical so fast. Let's bring it back to everyone listening. What are the absolute must-remember points from this deep dive?
The main thing is just how dangerous these common antidepressants can be if pets get into them. The effects are widespread: nervous system, heart, everything, and the signs can show up unpredictably.
Right.
So vigilance is key. Knowing if your pet could have accessed meds and recognizing those potential signs, lethargy, agitation, vomiting, weird heart rate, that's your cue to get help immediately.
Absolutely. And understanding this isn't about you diagnosing it yourself, obviously. It's about being empowered to act fast and give your vet crucial info in an emergency. Even if you just suspect TCA ingestion, time is critical. Get veterinary help right away.
Yeah, and it really makes you think, doesn't it, for everyone listening? These meds are common. Have you actually checked recently where yours are stored? Are they really secure from your pets? Those simple steps, they can literally save a life.
That's such a good point. And it makes you wonder, beyond TCAs, what other everyday things around our homes might pose these kinds of hidden risks to our pets? It's definitely a reminder to stay curious, stay informed about potential dangers that might just be hiding in plain sight.